I'm Kate Grace, physical therapist, founder of Our Joint Effort, designed completely to give you great orthopedic medical advice. You might be just one treatment away from getting your life back. What if you could find out that your body already has the power to heal itself? You just need to unlock it. So many of you have watched last week's podcast with Dr. Chris Rogers, who is a world famous, renowned, one of the best in the world specialists in regenerative medicine. Now, he is a scientist, so I know I lost some of you maybe in the middle of that podcast because he got a little scientific talking about cells and biologics and things like that. So today, live, so excuse any boo-boos, we are going to talk down and dirty about what regenerative medicine is and how it can help you. So this is going to be just like you have walked into my office, into my clinic, you're my patient, I've already examined you, diagnosed you, figured out that a regenerative medicine injection will probably help you, and I'm going to explain it to you and tell you what it's all about and how it can help you get rid of your pain. So what is it? PRP is platelet-rich plasma. Plasma is your blood, so you have red blood cells, you have white blood cells, and you have platelets. Within the platelets are those growth factor cells that, when they're injected, can actually heal tissue. What do we use PRP for? We use it to heal tendons, ligaments, cartilage, muscle, and fascia. That's what PRP does. It heals those soft tissue structures. What about stem cells? Well, that's a different harvesting process, but what do we use that for? Severe osteoarthritis. What is that? Well, when your cartilage wears down between two bones in your joint, or becomes thin, or maybe all the way worn down to the bone where there's exposed bone, we can inject stem cells into those joints, and the stem cells, who are super smart, are attracted to those arthritic conditions or exposed bone and lays down new cartilaginous cells. So that's the difference. They're used for very different things. So what's the treatment like? What happens? Well, the first thing that has to happen is the right diagnosis for you. You can have the best treatment in the world, but if it's not the right one for you, it's not going to work. So right diagnosis, choosing the right patient, preparing you for it. Get your nutrition great, eat your blueberries so your blood vessels are really ready to go, and get off your anti-inflammatory medications. So you go into the office, and for PRP, you get your blood drawn. Now, right there from the beginning, if it's not a phlebotomist drawing your blood, if it's the receptionist or somebody off the street, then probably should go to the exit. A real phlebotomist will draw your blood properly. Now, it's not drawn properly, then it can kill the cells. So that's right from the get-go. That has to happen right. Second thing, it has to be centrifuged right. There's only a couple machines in the world that do it properly. You have to centrifuge the blood to separate out the platelets, the red blood cells, and the white blood cells. So what you end up with is a vial that's a kind of a yellowish color. If you walk into the room and he's got a vial that's red, probably should head to the exit again, because if you inject red blood cells into a joint, it can be dangerous. So we only want platelets with those growth factors in there. A really good clinic will have a cell counter. At Chris's office, he can count the number of cells in that vial. We know that it takes 1 million, 2 million, 400 million, 1 billion cells to inject into a joint for it to be successful. If you're getting 50,000 cells, it's not going to work. So cell count is important. Then your injection has to happen under diagnostic ultrasound. That means we can take an ultrasound machine, put it over your joint, look inside the joint, identify the tear, and stick those cells right into where the tear is. So what happens is if your tissue should be nice and striated and you've got a tear in your joint, in your tissue, we can inject right into that tear, and in about a month, it'll look like that. And in about 3 months, it'll look like that. It's much better than what we had before, where we had to stick a bunch of sutures in there, sew it together, tie it into a knot, and hope that it stays and that it didn't work out. If you look at research projects 5 and 10 years down the road, people who had injections versus surgery even did better. So low risk, high success. Then the next part about this is the post-injection protocol, physical therapy protocol. Now, there weren't any many years ago, there weren't any protocols. We had the pleasure of writing them all for every single joint. So after 3 days, maybe 5, depending on how you feel, there is an inflammatory process that happens after this. So don't worry. People call me and say, oh, it's really sore. Yes, the inflammation process is how those cells regenerate. Once that's calmed down, you start physical therapy because you have some musculoskeletal faults that got you there in the first place. So an injection is not going to change that. If your big bowling ball head is forward and you have neck pain, the injection is not going to change the mechanical position of your head and your neck. It's not going to change your posture. It's not going to change the hypomobility of your spine or the flexibility or strength of your knee or your shoulder. Those have to be addressed because then with the injection, with the treatment to your musculoskeletal system, you'll get rid of it for good. Gone. Not going to come back unless you do something crazy. So it's that whole package that has to happen. Stem cells is a little bit different harvest process. Stem cells come from your adipose tissue. It's kind of like liposuction. So when I had mine done, I said, Chris, could you spend a little more time in here, around here? He said, no, I deny it. But that's the process. It still goes in the lab, you still process it, you still get a cell count, and you still inject it with diagnostic ultrasound. And then you follow the physical therapy protocol. So those are the two different stem cells, PRP. That's what we use them for, and that's the process. You have to know, I want you all to know that this exists. This treatment is not new. It's been around for quite a while, but it has to be done in the right hands by a specialist like Chris, who lives, eats, and breathes this, and not by somebody who just haphazardly got into the field. So it's funny, I do a lot of telemedicine or telehealth, and I have patients all over the world. And so I may see you as a patient from somewhere across the country, and I'll give you things to do. I can examine, I can diagnose you, and give you things to do to help you at home. But maybe you need a physical therapist to get their hands on you, to change your musculoskeletal system, and to mobilize your spine or your shoulder or your knee or your hip. So I've managed to get a very large group of good physical therapists around the world. So I'll call them and tell them what I found for you, give them my treatment plan, ask them to then let me know what they find, and then we collaborate together and treat you so no matter where you are. It works really great. But sometimes I say to them, they've got lateral condylitis or golfer's elbow or tennis elbow. And in addition to what you're going to do for them, they need a PRP injection. And I've had medical professionals say, what's that? And I'm like, what? What do you mean, what's that? You as a medical professional should know. And a huge part of our job is to educate our patients about it. There wasn't 1 week, since we started this many, many years ago, there wasn't 1 week in our clinic that went by that I did not discuss this with a patient. Not one. And it's our obligation, all you PTs out there, all you musculoskeletal experts, it's our job to let patients know that there is a treatment method out there for them that is high success, low risk, and they should absolutely attempt all good options before surgery. What are those good options? Really great PT. What's that? A good exam. Great manual therapy. Progressing you every single time. The therapist spends the time with you. She doesn't, or he doesn't spend 5 minutes with you, then send you off to do a bunch of exercises or to an aide to do something else. You can do exercises on your own. You don't need physical therapy. So when people say to me, oh, that's what I had, I said, well, you didn't have therapy yet. So I want you to know this is available. The other thing is I've always, in terms of good treatment, I've always said patients need to get early and the right treatment. So don't wait, okay, rest for a week or whatever, but usually these things don't go away on their own. I've always said patients should be treated like professional athletes. Like, did you see the French Open final last week with Alcaraz and Sinner? Alcaraz, my favorite, was down 2 sets. He wins 3 sets in a row to win. He has been wearing a knee brace lately, so I'm hoping that his team will be smart enough to exhaust all these possibilities before surgery, because no matter what we do in your knee, doctors call it minor surgery. It isn't really. If we just stick something in your knee and pull it back out, we pierce through the capsule of your knee and set you up for early arthritic changes. If they remove any of his cartilage, he's going to have early arthritic changes and loss of cartilage between those two bones. Kind of like Tiger, maybe he should have had that done before he had 25 surgeries. So just know that you need to exhaust all possible conservative treatments, and this being a great one, before you consider surgery. So sometimes in my evaluation, I'll say to the patient, well, I'm going to recommend a PRP injection for your rotator cuff tendon in your shoulder. Oh, I had that, it didn't work. Where did you go? And what did they do? Well, they went somewhere not good. They didn't have this protocol that I just described to you. And of course it didn't work. It's not going to work. If you don't go to a specialist, if this all they do, and you go to some doctor that went to a Holiday Inn weekend course and calls themselves a regenerative medicine specialist, it's not going to work. Don't waste your time. Don't waste your money. Do it right the first time and find someone who's really good at it. Now, I know some of you are watching, some of you watch later. After you like and subscribe and you put in a comment, if you are interested in exploring this in your area, tell me where you are and I'll help you find somebody. So we had a couple of patients. Maybe this is you. Maybe I've seen so many people with elbow problems, golfer's elbow, tennis elbow. I have a friend and a phenomenal athlete who had horrible tennis elbow. She couldn't even pick up a pencil. I mean, that's how bad it was. And to take her out of athletics was a big deal. She was a D1 tennis player. Then after she was done in college, she decided she was going to be a high-level beach volleyball player. Then she took up golf, and then she took up pickleball. I mean, she's an athlete. She had the biggest tendon tear I've ever seen, before or since. And her doctor said, you have to have surgery. There's no other way to fix this. I saw her, I said, look, you've got problems with your neck, your shoulder, your elbow. We can fix those, but you need an injection. She went to Dr. Rogers, she got an injection, and it healed. Not only did it take her pain away, visibly on ultrasound, a few weeks and then many more weeks later, you could actually see the tendon heal. There was visible evidence. Another friend of ours, sadly, in the middle of the night, fell down a lot of stairs. She tore her rotator cuff in her shoulder, and she tore some of her cartilage in her shoulder joint away from the bone. So she had two problems that I just described. She had a tendon problem, and she had a bone problem. She went to the doctor. He said, unless you have a total shoulder replacement, you'll never play golf again. Now, this is a really good golfer. And she came to see me. We did some therapy, and I said, I really think you can get better with some injections. She had PRP for the tendon in her shoulder. She had stem cells in her joint at the same time for the cartilage that got torn off the bone. She spent many months with me in therapy. It's now been several years. She's pain-free in her shoulder, and she's playing golf. So these are extreme cases. Now, there's mild cases where we've had hundreds and hundreds of successes, but these are hard cases. So it doesn't matter if it's your neck, your back, your hip, your knee, your ankle, your shoulder, your wrist, your elbow, any joint, this can help you. And you need to know it's there, and it's a great treatment option. Now that you know more than all your friends and a lot of medical professionals about this, here's my favorite segment of the show, AKA Ask Kate Anything. So now here's your chance. When I first opened my clinic, I was all by myself. And I treated patients, I scheduled patients, I did the billing, I cleaned the bathroom, everything. Well, then when we got bigger, I couldn't see everybody, so we had several other therapists, and everybody still wanted to see me. And I had to convince them that these are really well-trained and good therapists trained by me. And they were phenomenal. Now, though, here's your chance. You get me. You can ask me any question. You can contact us through our website. You can, anything you need, any question you have, please don't hesitate to let us help you, because our whole goal is to get everybody, we have to stop this horrible medical advice where people are not getting their problem solved. They're having unnecessary procedures, and they're having irreversible surgeries. So our sole goal in this is to make sure you get really good advice and you know what's on the cutting edge of treatment, and that's what this is. So here's your chance. You can ask me any question now. You can put it in the comments later. I don't know if we have any questions or not, but my lovely producer is saying yes. What's our question?
Jamie would like to know how many injections does it take to heal her tissue?
That's a good question. So how many injections does it take to heal the tissue? Well, in the right hands, usually one. I know that's crazy to think, but usually if it's done right, those cells, they'll last in your body for a long time. You may realize results or effects from that injection for a year or 2 years. Those cells regenerate, they proliferate, they go tell other cells, come over here and do this. So if it's done right, many, many times, it's one time. And there are clinics out there, I know you've been to some, that say, well, you're going to need 3 to 5 of these. Well, that's just not true. So there you go. Jamie, thanks for asking.
Sue would like to know what's the downtime.
Okay, good question. What's the downtime? This is a great question because it's really different than surgery. Let's say it's your rotator cuff. Let's take that. If that's a big joint and a joint that you use all the time in sports, when you get your injection, you're going to calm down for a few days, and then you're going to start therapy. Within a few weeks, depending, let's say you're a golfer. Within a few weeks, you're going to be out putting. Maybe another week, you're going to be chipping. And then in another week, you're going to be working your way up your bag. So the downtime is really, really short. And it really depends on your injury, where it is, the extent of your injury, your pain level. So we really go by comfort of our patient. It's not like you're going to go back to your sport and tear something, because those cells are in there healing it. So it's very different than if we operate on someone and we want to protect that area for a long time because we have to let whatever we did in there heal. So the downtime is really, really low. And it doesn't have the risk of surgery. There's no anesthetic. There's no risk of surgery. There's no, once you get your joint open, it's going to take much longer time to heal. I mean, some rotator cuff patients don't get back to playing their sport or playing with their kids or their grandkids for 6 months. So this downtime is really, really short. Thank you, Susie. Thank you.
And Betsy would like to know, to your knowledge, is this type of treatment covered by insurance?
Oh, Betsy. Sadly, no. Right now it's not. I'm sure one day it will be, but right now it's a cash business, and a lot of people will work with you on that cost, whether it's over time or payments or whatnot. But, this is crazy. Insurance companies will spend $50,000 on a surgery, but they won't spend $2,000 on something like this. So I think that with every passing month, it gets obvious that this is a better way to treat orthopedic problems and more effective, cost effective for them and for everyone else, and avoiding the risks of surgery. And then let's say you have a problem in surgery. Well, then the insurance company's got to pay for more treatment after that and more treatment after that. So right now, no. So save your pennies, stop going to Starbucks, save up, and get the right treatment and one that'll help you. Thank you, Betsy.
Tyler would like to know, he's had a cortisone injection. Is that the same thing?
That's a question I get asked a lot. Cortisone, all cortisone is designed for, whether it's in a joint or your spine, is to draw the fluid out of the joint. That's all. And for pain relief. It does not solve the problem, fix the problem, or do anything to heal anything. And the bad thing about cortisone, and doctors use this all the time because it's a quick fix, makes them look good. And, oh yeah, my doctor did this and my shoulder felt good for about 2 weeks. That's about all it's going to feel good for. So the other thing that's really not good about cortisone is cortisone, the steroid, inhibits cell growth. So if you are considering a regenerative medicine injection, either one, do not have a cortisone injection, because you're going to have to wait. If you do, you're going to have to wait several months depending on the doctor, maybe 3 months and maybe 6 months before you can have a regenerative medicine injection, because the cortisone is going to inhibit the benefit of that injection. So cortisone's a Band-Aid. You know, it doesn't matter what it's for. Let me tell you when we use cortisone. You have severe arthritis in your knee, you went hiking, maybe you fell, you overdid it in some way. Your knee is as big as a softball. It is so swollen, you've iced it, you've elevated it, you've done everything you can, you've squeezed your knee, you've contracted your quads, and you just can't get rid of it, and you're in horrible pain, and you can't even walk on it. All right, let's drain the fluid out of your knee and give you a cortisone injection. That's usually not the case. That's severe. Or maybe your ankle, you know, something like that. But reserve those treatments for yourself for those extremes, and use these treatments that will actually heal it. It will actually heal it. It's not a Band-Aid. It's not temporary. It will heal. Those cells are designed to heal tissue. So thank you for that question.
This is a two-parter.
Oh, no, forget it.
How soon and how often after a PRP treatment should you have manual physical therapy? And exactly what is manual physical therapy?
Okay, I hope you heard my lovely producer, but how soon after a PRP injection should you have, and how often should you have manual physical therapy, and what is it? That's a really good question, because what we do in physical therapy, there's a science that we learn, and there's an art. The art comes from getting your hands on the patient. And if you go somewhere and they're not getting their hands on you, let me help you find somewhere else. I have people all over that can do a good job for you. So you can start within 3 to 5 days. That's when we start. That's when I started, when I've had my injections. It's really up to you on your pain level. If you go home and you're sore, pretty sore for 3 days, and then a little less sore 4 or 5, you could start on the 5th day, but don't start any later than that. Because what we want to do is maximize the benefit of your injection and start working on those musculoskeletal faults so they don't keep causing abnormal mechanical forces on your joint. What manual therapy is, if you came to see me and your knee was swollen and sore and you've lost your range of motion and your knee is weak, first thing I would do after my exam and my diagnosis, I'd elevate your leg. I'd work all the fluid out of your leg. Now we do this often after total knee replacements, which they should start right again. Total knees, start within a week. Don't wait. I treated my mom, and I had her leg up in the air, and he was so swollen. I was pushing this fluid out, and it's not fun. It's painful. And I was moving the fluid out, and then she goes, "That's enough, honey." I said, she can't say that to anybody else. But we would work the fluid out of your knee. I would mobilize your patella, mobilize your tibia and your femur, start working on your range of motion, and then start activating all the muscles in your leg. That's all done with the therapist's hands. So whenever a therapist has their hands on you, that's manual therapy. Other therapy is walking around and doing exercises and working with somebody who's not really trained. I travel all over the world doing patellofemoral dysfunction courses. And I've been in too many physical therapy clinics to count. And I went in this one clinic, there was a gym there, and they had an aide in there by himself showing the patient some exercises. So that's illegal. So you shouldn't be working with an aide. And 2, I said to the therapist, I said, well, explain to me, what's he doing over there? And he said, and I quote, "That's what we do on Tuesdays." And I went, oh my gosh. So your manual therapy treatment should be right from the first treatment, and then it should progress as you continue. So maybe we've worked all the fluid out. Now we're going to really increase your strengthening of your leg. We're going to address your hip, your inflexibility, your posture malalignments. All of that is really good manual therapy. That's a really, I don't know who asked that, but that was
Betsy.
Oh, that's a really good question. You are really on the upper echelon of the learning curve here, Betsy. Wherever you are, whoever you are.
And then Kathy has asked, what if you wait to get treatment? Would it be too late for PRP, or is it still the best option?
That's a good question. What if you wait to get treatment? I don't know how long she's waited. Did she say?
No.
Okay, well, let's say you're one of those procrastinators and you just don't jump right in. You're like, oh, it'll get better. Again, don't wait a week, 2 weeks, maybe but it's usually not going to go away on its own. So yes, you can still get it, because if the cause of your problem is a tear in your tissue or it's osteoarthritis in your knee, the tear is going to be still there, the arthritis is still going to be there, and you can have those treatments anytime. But don't wait. I mean, through my career, I've taken this history. This happened 6 months ago. I went to this doctor, he said, do this, that didn't work. So I went to another doctor, that didn't work. I went to this therapist, that didn't work. And I saw them and I thought, that's not how you treat this. Oh my gosh, this is so obvious. And after 6 months of that and pain and inactivity, they were done in our clinic in 2 weeks. So if you get to the right person, please, people, your orthopedic pain and dysfunction and inactivity can be solved relatively quickly. It's not that difficult if you work with somebody who is fiercely dedicated to finding the diagnosis and changing that. And the most important question on my evaluation is, what are the patient's goals? Maybe you want to go play pickleball. Maybe you want to play with your grandkids. Maybe you want to hike. Maybe you want to paddleboard. Whatever it is, a good therapist will get you there to match your goals.
Julie has asked, can PRP or stem cell help a diagnosed ACL or PCL tear?
Oh, Julie said, that's a good question. PRP help an ACL or PCL tear? That's a really good question. They are now just starting. There are some places, I think there's one doctor in Colorado, and I think another, I read some research recently, who are experimenting with PRP into ACLs and probably PCLs as well. I haven't read the data, so I don't know. But if you look up clinical trials, or you look that up on AI or Google or whatever, you should be able to find who's doing it. There's a site where you can look up clinicaltrials.org. Go on there and you can look up the latest clinical trials, and probably in those clinical trials, there's something about that. Regarding ACLs, and either 2 weeks from now or 4 weeks from now, we're going to cover ACLs, what to do if you tear it, what surgery is like, and that kind of thing. But generally, if you completely tear your ACL, you're going to need to have it operated on, and I'll talk about all the types of grafts and the process of that. If it's 1/3 torn, then you probably don't need therapy, and you probably can get away with an injection in your knee and physical therapy. It's that 2/3 tear that is kind of the mystery, and it really depends on your stability. But the number one thing with ACLs is you must do physical therapy first for several months, then determine your activity level. So let's say you are fine and you can go back and play soccer, but let's say you're not, and every time you shift to the side or do a lateral movement, your knee's unstable. You're probably going to be a candidate too, but I will cover that very thoroughly. And thank you for asking that, because between now and when we air the ACL interview, you need to listen to this woman who I met at a party, who was 3 days later was about to have her 3rd ACL surgery. And if she that would have failed. And she said, I would live the rest of my life. I said, that's it. I'm not having any more surgery. I would live the rest of my life with a bad knee. Wait till you see her interview. I won't tell you what happened. And then I'm going to follow that up by telling you what to do when you tear your ACL. But between now and then, so Julie, I'm going to research that, and I'm going to cover that in, it's either going to be 2 or 4 weeks. I'm not sure. But wow, great. These are great questions.
Yeah. This kind of goes along with it. How about those who have had surgeries? Will PRP treatment still help?
Yes, those of you who have had surgery, depending on what you've had, yes, it still will help. So that's when the diagnosis with the diagnostic ultrasound comes in handy. I've had patients who had surgery for something else, yet they either missed it or they didn't address it in surgery, and they had something else going on in surgery, and that didn't get fixed. Now we can do an injection for that. So yes, you can still have it after surgery. These are great questions.
Right.
Now I try to keep these to a half hour. We're at the half hour mark. So I appreciate everybody tuning in. Once you like, subscribe, go ahead and ask me any question in the comments. I will answer every single one. If you're interested in looking at our, contacting us, go on ourjointeffort.com and the podcast page. Then you will be able to contact us. And also in your comments, if you could, with me after you've subscribed and liked, please let me know what you want to learn about. Let me know, what do you want to hear about? What's your challenge? It may be something very unusual or something that 10,000 other people have. So you will help everybody by asking that question. So I appreciate you tuning in very much. We are thrilled to be able to do this, and our whole goal is to give you great advice. And know that this is on the cutting edge for you, and it's a great, great treatment. And if you want, let me know. If you want to have Chris come back, we'll come back and do a Q&A with Chris. And I look forward to seeing you next time for Recover the Knee next time. And I know there's a lot of people out there with knee challenges, so join us, and I look forward to helping you with your orthopedic problem.